Those models from top researchers in our state are driving the decisions of Arizona's leaders on how to respond to this worst pandemic of our lifetimes. So why isn't it public? Why aren't we allowed to see them? ABC 15 investigator Melissa Blasius has spent weeks trying to uncover this information, but keeps hitting roadblocks.
Think of this as Arizona's medical monsoon. We see the dust coming. We know the worst is almost here. And like weather forecasts, there are forecasts predicting the spread of coronavirus, information that could affect our lives and our health, information that Governor Ducey and the state health director have been hesitant to share.
Arizona Governor Doug Ducey makes a promise almost every time he talks publicly about COVID-19.
You know everything I know.
But for weeks, we've known the Arizona Department of Health Services has a modeling team tasked with making educated guesses about what will happen next with coronavirus. ABC 15 has repeatedly asked to see the models and calculations to share with the public. This was the governor's response 9 days ago.
I've made a commitment that we're going to be timely and transparent. When I know something, you're going to know something. We're putting out all the information that I'm being briefed on.
Former Arizona Department of Health Services Director Will Humble explains why transparency is critical.
As a health department, you're asking people, especially during a pandemic, to do some really profound things in terms of changing their behavior around work, around school, around doing things in the community. Now we're discussion about masks and stuff. And so you're in a better position as a health department if you've got the kind of street credibility that you need and the trust that you need among the public so that when you ask them to do something, they trust you and they do it.
Instead of giving us their internal calculations, ADHS, now headed by Dr. Kara Christ, provided us national and international studies they said they were consulting. Last month, Dr. Christ threw out huge numbers that Arizona would need 13,000 more hospital beds and 1,500 more ICU beds.
The estimated need is rapidly evolving as we gather new data. With a potential surge of COVID-19 patients, we expect it to be above and beyond our current capacity of beds.
Tuesday of this week, Director Christ explained those numbers were scratch paper calculations.
Looking at when we didn't have a lot of data, it was 1 to 2% of the population would projected to be infected. We based then that 6% of that population off of Wuhan would need hospitalization or have severe. That put us between about 48 and 8,400 individuals.
Tuesday, she made a big swing in calculations of ventilators needed from 5,000 originally to less than 500 now.
We're working with the universities to develop the actual modeling, but it changes every single day.
ABC 15 has learned these researchers from the University of Arizona and ASU were asked to conduct the modeling.
Impressive people with good credentials, and I trust them.
Joe Gerald is an expert in tracking healthcare costs to treat respiratory illnesses. Timothy Lant is a director of biomedical modeling. Megan Jen is an epidemiologist who researches emergency preparedness. Timothy James is an economy professor who specializes in sustainability. None agreed to interview with ABC 15. An ASU spokesman said their modeling was sent to ADHS for review and questions should be directed there. ABC 15 has made an official public records request to ADHS, but the models and reports have not been released with no explanation.
This is not something that's trivial or inexpensive. If you're a hospital and you have declining revenue because you've had to cancel all your elective procedures, and now you've got to increase your capacity by 50%, that's no small order, especially in a declining revenue environment. And so if the model shows with better clarity that there are not as many beds as they had originally anticipated, perhaps that would influence the original executive order and the expectations that the hospital have under that order.
Governor Ducey and Dr. Christ have promised to release additional information on this dashboard about COVID-19 hospital admissions and ICU beds, as well as more detailed geographic data in the next week. But they have not promised to release the in-state models, even after other states like neighboring Colorado have done so. And several national models already exist, offering specific Arizona information, showing hospitals in several counties will exceed capacity this month, handing out a B- grade for our social distancing efforts, and even predicting how many Arizonans will likely die from coronavirus. When reporters raised that topic, the governor has shut down press conferences twice.
That anybody that tells you exactly what's going to happen into the future is guessing. and I'm not guessing. And in closing, the idea is to reduce the number of deaths.
Governor Ducey, who's a skilled marketer, has been mindful of how he's presenting coronavirus information. For example, instead of a statewide quarantine or shelter in place, his order was called Stay Home, Stay Healthy, Stay Connected.
Because I think there's enough out there to cause fear and anxiety in people.
ABC 15 will continue to press our state leaders to release the models and data they are using to make decisions. In the meantime, if you want to see the national models that talk about Arizona, we've posted those to our website, abc15.com. I'm investigator Melissa Blasius, ABC 15 Arizona.